Well, there were some fireworks inside a hearing on this hot issue of contraception coverage. Health and Human Services Secretary Kathleen Sebelius being grilled on how the feds plan to pay for government-mandated birth control coverage for all women. Watch.
Who pays for it? There's no such thing as a free service.
The reduction in a number of pregnancies compensates for the cost of contraception. The overall plan,
but by
according
not
to the National
having
Business
babies
Fund,
born,
goes
we're saving
down,
money.
not up.
I just want to get this on the record, Mr. Chairman. So you're saying by not having babies born, we're going to save money in health care?
Providing contraception as a critical preventive health benefit for women and for their children reduces health.
Not having babies born is a critical benefit. This is absolutely amazing to me. I yield back.
Oof. Tense moment there between Kathleen Sebelius and the gentleman who you see on the screen here. Pennsylvania Republican Tim Murphy is a doctor, and he's the congressman who was questioning her moments ago. Good morning, Congressman. Good to have you here.
Good morning.
What got you so fired up in that exchange?
Well, you know, for the longest time, I couldn't understand after weeks of this hanging on where many religious institutions around the country were saying, don't mandate that we do something that is against our faith principles. The administration wouldn't do it. I mean, they did offer some services for free, which is a distinction without a difference. And I couldn't understand why the administration was pushing this. Well, then I understood it. When Secretary Sebelius said that basically pregnancy is an expense, and that means by not having to pay for prenatal care, not having to pay for labor and delivery or the pediatric costs of raising a child, they figured they could save a lot of money. And it really baffled me how we were going to expect to pay for health care by not having babies. I thought that was one of the points of providing health care for women. And quite frankly, it doesn't make sense financially, and it certainly is an offense to the faiths that all along we're trying to bring this up.
You know, it comes down to this, perhaps. You know, she's arguing that it's sort of a general welfare issue, and she believes that everyone should pay for this coverage, you know, for the greater good of everyone, and that the fewer, babies that are born, the more contraception that's out there and fewer babies that are born, overall, the cost for health care will be lower across the board. And that's one of the missions of the health care reform, is to put a lid on health care costs overall, right?
Well, that's what she thinks, but according to Reimbursement Intelligence, an online survey of, I think, 15 pharmacy benefit representatives who represent 100 million employees, 50% of them actually said it would increase costs. 30% said they didn't know, and 20% said they thought it would remain the same. So this idea may not be borne out in the actual numbers. And, you know, quite frankly, if it did save healthcare dollars, why didn't insurance companies provide it as a free service in the first place?
Is there a slippery slope here, you know, in terms of government infringing on people's, you know, decisions to, you know, have children? You think about the way things are in China, and no one's suggesting that that's where we're headed here. But I give that as the most extreme example in terms of the suggestions that might be made for lowering the costs of health care overall. Open question.
Well, it has to do with what's also being raised by the Independent Payment Advisory Board and making decisions about what is paid for and what is not. And what the administration has now laid out is they'll be making decisions in terms of what is going to cost money. And you're absolutely right raising this question, which others have raised. What comes next? If churches and religious institutions are saying they're very concerned about heading down this road, the morning after pill and others paying for that, what comes next? What do we do with people who are very ill? What do we do with terminally ill people? What do we do with the elderly? What do we do with developmentally disabled children? It raises those fundamental questions. Now, I'm not suggesting the administration is pushing those directions, but it does continue down that road, which is one of the reasons why so many church officials are deeply concerned about this.
Understood. And I go back to that issue of whether or not contraception in general is a personal responsibility or whether it's a general welfare issue that all Americans need to pay into to cover for each other. And I just put that out there as, you know, something for people to think about and decide how they feel about it. Congressman and Dr. Tim Murphy, always good to see you, sir. Thank you very much.
Thank you very much.
Right about 19 minutes past the hour. What happens when your doctor is the patient